Welcome to Trifecta Collective, Finding the Root with Megan and Shannon, the podcast where we dive deep into all things health and wellness to help you find health and healing inside and out for now and forever. Hello and welcome to Trifecta Collective, Finding the Root with Megan and Shannon. I am Megan Abbott, owner and founder of the holistic health practice Trifecta Collective. And this is my co-host Shannon Callery, and she is the head practitioner of the practice. And welcome to the podcast.
Yeah, I'm so excited for today. We're going to talk about, this is going to be a less educational one, more just conversation, kind of talking about our experiences. And yeah, we're going to get into some good stuff. We're going to talk about medical trauma and tons of good stuff around that.
Yes. And if you have chronic health issues, you will probably resonate with some of the things that we're going to share today, some of our personal experiences, a lot of the things that we see. I also, we'll just talk a little bit more too about like Western medicine and Western medicine's approach to health, and where some of the discrepancies lie between Western medicine and some of the more holistic health practices are concerned. So yeah, I think we'll just start with sharing some of our personal stories with the medical system and medical trauma, and go from there.
Yeah, that sounds good. And we recently both kind of had that. Well, I don't know if you experienced this so much when you went in, but I'm sure you did a little bit. But this came up recently for the both of us, which is why we decided to do an episode on it. But I mean, this is something that I started to experience like fairly young, I would say, because my health issues started young, started going in to see different doctors. And I think the biggest thing here is just that Western medicine, with the system that they have set up, they're not like allocated enough time to spend per person. Like it's very difficult to dive in and actually feel like heard and validated and like someone's understanding you when you're only spending 10 to 15 minutes with a person. So it's unfortunate that that's the way it's set up, but that's kind of where this all starts, is like, you're going in. For me personally, like I was going in, getting blood tests for all these different things, and they were coming back. Everyone was telling me I was fine. But here I was like not able to function, not able to get out of bed in the morning, just feeling like crap all the time, getting bloated all the time, stomach pains. And everyone was telling me that I was fine. Or it was like, just asking the same questions over and over again, going to see different specialists. I think I saw like 10 different GI doctors, if not more than that, who they all had the same solution, like blood work is good, let's take Miralax. And it's just like, when you hear that over and over again, you're like, okay, no one's listening to me. You start to feel like you're crazy. And that's a really big part of that. So for me, that's why I decided to dive into this and completely learn all that I could on my own. And that's a big, even though I saw practitioners in the functional holistic realm, and it was better because I did get to spend more time with them, like half hour, which was a lot better. Just like feeling understood and like someone was believing me was a huge part in that. And I think that's a huge difference when people come to us. I mean, we're meeting with them every single week. We're spending a half hour, if not more, with some people. You are able to talk, and just having someone listen to you is such a huge piece to this.
Yeah, for sure. And I want to make a clarification here too before we go even deeper into this. Western medicine is great. Thank goodness for Western medicine. If I was ever in a car accident and like cut open and needed surgery, like thank goodness for Western medicine. Amazing advances and all that kind of stuff, and very, very grateful for Western medicine.
Yep.
And when it comes to a lot of chronic issues, Western medicine isn't set up to address chronic issues, especially or I'll say when they're, I don't want to say even say early stage, but when they're not so full blown that it's a very clear medical diagnosis, or they can pinpoint a thing, or they can give a pill for a thing. And also, just Western medicine's not set up for this. I mean, they're not educated around this either. If we look at, and I say this having learned more, I also have family members in the Western medicine space. And when I hear them talk about how they approach chronic issues, and just to share a little bit more what I'm really referring to. So I didn't grow up with my father, and we do have a relationship now. And my father is an MD, he's a PhD, he's very intelligent. He also works and has worked for a decent period of time. I don't know exactly how long, in designing pharmaceuticals and drugs. And when I hear him talk about different things he's working on, projects and pills, and my brain sometimes has a really hard time comprehending why and why. And I get it. I get it. You have lab testing, you have an issue, you get a pill to manage the symptoms. And once again, thank goodness for Western medicine and being able to help and manage certain things. And they're just not trained to look at the bigger picture. They're not trained in nutrition or lifestyle. And even when they do more research around this, it is with a very oftentimes, and this is not 100% of people in the medical field, but a very narrow scope. And I've also worked with a ton of nurses, and a lot of them start to realize this when they experience their own chronic issues, that they're just not trained. They're not trained in certain labs. They're not trained to understand a lot of the physiology and what these tests are actually looking at, and the value of certain tests. A very good example is if you've ever had thyroid issues or suspected thyroid issues, and you go to any doctor trained in Western medicine, chances are they're going to run TSH. If you're really lucky, they're going to run free T4. And that is it. Once again, they're just not trained to look at anything else. If you see an endocrinologist, they might test you for some antibodies, TPO, TG antibodies, even like TSI. I've never seen any physicians run that, which looks at some other end of the spectrum of thyroid issues. They're just not trained in this. And I have a close friend, and we've chatted about this before, who is a trained nurse practitioner, and she went into the functional medicine world. And not long ago did she do like a very specific hormone training where she learned what T3 is and why to run free T3 and the value of that. And this was not in her functional medicine program either, for reference. This was a separate training that she did years later, where she learned what this value was, the value of it. And we know in the holistic health space, free T3, that's what our body's actually using. That's what, there's a conversion process. And if we're not converting, you're going to have thyroid symptoms. And T3 has so much value, not only free T3, total T3, T3 uptake, reverse T3. All of these things have so much value. And Western medicine just doesn't look at this. It's really designed to, all right, here are some, based on your symptoms, here are some labs, and here are the ranges based on the general population, very, very wide ranges, which once again, we're looking at general population, which a lot of the population doesn't feel the best. Let's also just keep that in mind. And then based on that, if you have something wildly out of range, and usually it takes a wildly out of range marker, then if there's a pill, they give you the pill. Once again, this is how they are trained. And when it comes to acute issues, great, amazing, thank goodness. And when it comes to chronic issues, man, do we miss a lot of the time.
Yeah, and kind of tailing off that, when I was in school for public health, that's what I went to college for. I remember learning about the downstream approach and the upstream approach. And, they kind of always put Western medicine in that downstream approach, even though it's more of an upstream approach, because what you're saying is that, and we've all experienced this, they're typically not going to run labs, or if they do run labs, if I'm coming in and saying like, I'm uncomfortable, I'm bloated, like this, and this is going on, and they run some labs, if everything is like in line with their markers, they're going to tell you that you're good. You're good to go. Everything is fine. And that is more of an upstream approach, because if they were actually taught to look at imbalances and whatnot, kind of how Megan and I do things in the functional world, that is a downstream approach. We want to look like way ahead of time. If you're having symptoms, and of course our ranges are smaller and larger in some areas, but we're able to like pinpoint and see the patterns that are going on, that is a downstream approach, meaning like we're looking way ahead of time. We want to catch things before they turn into like a big issue, a chronic issue, and whatnot. So that's a little bit of the difference as well.
Yeah, and the other piece of this, and I think I touched mildly on this just now, but it's also really important to understand what we're looking at in these labs. Classic example, iron. And when
That's a big one.
even in a lot of functional medicine type programs and trainings, they're looking at ferritin, they're looking at serum iron, which are valuable markers and not the most valuable if we look at really what these things are looking at and how things can go wrong with iron levels. Serum iron is looking at iron outside of the cell, which, okay, and what's getting in the cell? What's going on inside of that? How much iron are we actually absorbing? Are we absorbing iron? Do we have too much iron? Do we have too little iron? What else is playing a role in here? Are we missing nutrients to actually be able to fully absorb the iron? How much iron does your body want? Which is a whole other marker. That's TIBC, total iron binding capacity. Ferritin is impacted wildly by so many things, including inflammation. And so this is why looking at bigger picture, understanding what these labs are actually looking at, which was part of our program and training in understanding labs, which is, why when people come to us and they're like, oh, my labs are fine, we always want to take a second look, because I have yet to see anyone, including myself,
yeah, I was just going to say same thing,
with perfect labs. And it's not about being perfect. It's not about perfection, but it's understanding what's going on in the body right now and how the body's asking to be supported to work the most optimally.
It is insane to me how we have all these other markers that are like really true iron markers, like iron saturation and TIBC. And almost no one runs those. Like they're not common markers to run. And I don't, that is something I will never understand. Like when people come to us and they're like, oh yeah, I have my ferritin, like that's iron. I'm like, no, we need so much more here, because we can't, and it's so easy to get added iron. And like I think we've talked about this before, how iron saturation, that's a problem. It's super hard on your liver. It causes a whole bunch of other issues. Same thing with like not having enough iron and fatigue and all these other things. So that's a really important piece to the puzzle. And we can't, like, we need to see that to know like what supplements are okay for you, what's not okay. Like that's such a big piece to this too. So just, yeah, having that knowledge and being able to ask for more things and advocate for yourself too. So I hope you're learning something from listening to this, because you can do this research and like go in and ask on your own too. That is part of, advocating for yourself, speaking your needs, asking for what you need when you're in the doctor's office. That is also okay to do.
Yeah, and even, I mean, I had an experience in the functional world where someone was only trained, and that's on me for not asking for more clarification on her training, even though it was a well-respected individual created the program that this person went through, a very well-respected person in the holistic health space and the functional medicine space. So I just blanket trusted it. Should have asked some more questions, but I ended up with iron oversaturation, which contributed to a lot of fatigue and issues. And this is because they weren't trained, even in the holistic world, trained appropriately in understanding full spectrum labs. And so it is, whether it doesn't really matter who you're working with, ask questions.
Mhm.
If it's a person who's been there, who understands, who is really there to support you, they won't get offended by questions. We get a lot of questions a lot of the time, and we encourage it because we've all been there and we've all been, we'll just say, had a variety of issues in both the Western medicine and even functional medicine space. And questions are important. Advocating for yourself is so important so you don't end up in a worse place.
Yeah, and I'd say that's something that, you know, if your current doctor or whomever you're seeing maybe gets like is either shutting you down in straight up telling you like, no, we don't need to do that, or again, just like not listening to what you want to do, that is a pretty good sign that you might want to look into finding someone else because, like Megan was saying, questions are welcomed. Like if you're asking a question, it's because you're trying to get clarity on something, and there is absolutely nothing wrong with that. You should fully understand, like, when you're working with someone, what their end goal is, what supplements you're taking, what medication you're taking, and whatnot. So yeah, that's always a big red flag to me, is when someone just immediately shuts you down. In my head, I'm like, okay, you're not a person that I want to work with or see anymore.
Yeah. And, for me, this really started, after my car accident and I started having a lot of chronic pain issues and then other chronic type health issues. I saw 8 different physical therapists. And so this is also not just like, MDs. This
Yeah.
is really Western medicine. This is all across the board of, everyone that I saw in physical therapy always looked at my low back because that's where my pain was. I had chronic pain in my low back. It hurt so bad. And no one looked, like at my hips or at my mid back, my thoracic spine. No one looked at, because I was in a car accident. So I had a seatbelt on. Like, no one looked under my rib cage or even just rotation of my shoulders. No one looked at my feet and my ankle mobility, and then when I started having chronic pain, even like sciatic type pain, they were just like, oh, do these nerve glides, just stretch out the nerve. And meanwhile, I started standing because I didn't have feeling for a whole year in my right leg. I started standing really wonky, and that contributed to like a hip shift in my knees, and my ankles got super weird place that I was just naturally standing because I didn't know. I didn't have feeling, and no one looked at that. And I saw, once again, 8 physical therapists of ranging specialties and varieties. Not all of them were covered by insurance. Some were private practice, some were strength and conditioning type coaches as well, which I was hoping would be better and they would look a little bit, at broader picture. And when I would express I had pain, and this was basically the reason I fired every single one of them, is at some point in the treatment, they were like, you're fine. Your range of movement is fine. Just everything looks fine. I don't know why you're having pain. It's probably in your head.
Ah,
And
that one gets me.
I heard that so many times from all kinds of people and practitioners and doctors, and just it's in your head. And I had so many physicians try and offer me anti-anxiety meds and antidepressant meds. And I had been on those for 10 years and never felt good. And there was no way I wanted to go back on those. Not that they don't have value, not that they're not good temporarily, but that was not what that it was not on the table for me. Same thing I was in a chronic pain clinic and saw a chronic pain specialist and a spine specialist, and I did so many injections and treatments, and they were like, well, here's opioids and you're on pain management for the rest of your life and you're not 30 yet. And no one asked me, hey, do you happen to have a history of addiction in your family that maybe we really need to think about this? And is this going to be a really good idea? Me having known my family history of addiction, there was no way I was going on opioids because I had a strong feeling I was going to be addicted immediately. And once again, not saying that's a bad thing. It's not, if you need those, great. And for me personally, there was no way that was the right decision for me at any point in time. But uh, that was the only option because it's just in your head. This is the only solution we have at this point.
Yeah. And I was going to say, like, to be clear here, because we talk about this a lot too. So stress, anxiety, depression, mental health issues, trauma, whatever you want to call it, can be an issue here. So it's not that they're fully wrong when they're saying, like, have you ever thought about like anxiety or something like that? But the problem is that one, they're not normally saying it in a very like understanding way. Or it could not be. Like in your case, you were having pain. It wasn't a fake thing. You were actually having pain. But that trauma piece is something that they tend to not know or understand how to dig into either. Because like for me, stress, anxiety, trauma, all of that was a huge factor. I literally couldn't get to where my body needed to be until I addressed that piece. And, when they say like, oh, do you want to go on this drug to help it or whatever, that's their only option. They're not giving you other suggestions. And let me tell you, there is so many things out there other than that you can try. So that stress and trauma piece is a factor here too, but Western medicine just isn't well educated on where to go in that direction.
Exactly. And yes, I was depressed. I was in pain all day, every day. Of of course, I was anxious because I couldn't do normal things. Standing for more than 15 minutes hurt. And once again, I wasn't even 30 years old. Like, not a normal thing. I couldn't go work out like I was used to. Just like everything hurt and it was exhausting physically, mentally, emotionally. And it really wasn't until I saw a certain type of functional practitioner who ran an organic acids test that was like, oh, also, along with all of your issues, you're also not producing any neurotransmitters, dopamine, epinephrine, norepinephrine, serotonin. Of course, you're going to be depressed and anxious because you're not making any of these neurotransmitters that are needed for optimal or even just a day-to-day, quote unquote, more normal mental health situation.
Yeah. And then, I mean, that functional testing piece is just so beneficial in so many different areas. And having someone look at it who understands it in a different manner and whatnot, you can really get a lot out of it. But going back to what you said, when someone is sitting there like telling you, that just not listening to you, telling you no, that you're wrong or that it's anxiety or that, the pain is in your head, that starts to fuel your fire as well and can also add to the problem. I mean, I've had that jumping into more like recent experiences in really realizing that medical trauma was like a thing for me that maybe I didn't pay attention to so much. My not only my own experience, but my partner got sick in the beginning of the year and it was a whole thing. And it's really hard, like when you have the brains that we have in like our critical, I don't know, thinking process, or just like knowing what we know as far as root issues, that when he went into the emergency room and urgent care and all the things, it was just like kind of getting passed around, knowing that no one was going to really help him with what the root issue was going on. That stirred up a lot of stuff for me. It was so like, I got anxious and agitated. I had to pull myself back because of course, like I didn't want to make his situation worse, but just like, you don't realize how much it sticks with you when you've been through it so often. And even coming out of that and working on it, I recently just had an appointment with a gynecologist, and I really went in with the mindset of like, you know what, like no negativity here. We're just going to go in, annual checkup, see how it goes. If I have any questions that I want to ask, I'm going to ask them. And that's the part that always trips me up is like, I have those expectations in my head. So I know when I ask, I know I'm not going to get the answer that I want to get, but I'm just trying to let it go and work through it. And it was the same thing. Like, I think the whole appointment was like 10 minutes long, not really time for anything, not willing to run labs because I didn't have any history, regardless of like the things that I was bringing up. And yeah, it's tough. It is a tough thing to work through.
It is, and I actually just thought of another story, but I'm gonna stay on the gynecologist because I've had two experiences now with the same one, who, by the way, was highly recommended to me in the more holistic health space. And to her credit, obviously, I'm not going to name her name, but to her credit, she does often spend more time. I think I did get like 15 to 20 minutes both times when I last saw her, which is definitely above the norm, which I appreciated. And she's a very talkative person and very open
Was she a
with it.
DO, a doctor of osteopathic?
Nope.
Oh, okay.
Yeah, she's just a
Wow.
regular gynecologist. Yeah. So I was very impressed with that the first time I saw her. And kind of towards the tail end, when I was still having some lingering issues, specifically like lower belly bloat, and I was hesitant to get off of birth control. And that was like one of the last steps that I was like, all right, it is officially time to get off of birth control. I had an IUD in, it was time for it to get changed anyways. And I was like, let's just take it out. Let's see how this goes. I've been on birth control for 16 years. And so when I was sharing why I wanted to get off, one, there was a lot of pushback of maybe you should stay on. We can just change it. We can change the type if you'd like. But I felt pressured to stay on birth control. And I felt like I really had a fight to ask, to say, I want this out of my body. I want this foreign object out of my body. I do not want to go back on the pill. Crazy emotion stuff that often came with that for me, along with many other people. And when I shared that, I was like, look, I've done all of this work. All of these things that I do, I was like, I do coffee enemas, I do castor oil packs, all of these things. And I still have this. And I just want to see if this is playing a role. I'm open to putting it back in. If it's not, I was like, I don't know what my hormones are doing. I've been on birth control for so long. It's like, I don't know, maybe I have some PCOS stuff. Maybe I have some endometriosis stuff. I just don't know. And I wanted to say retaliation, but that's not quite the right word. It wasn't quite that combative. It felt like it in my
Yeah,
mind.
because you have to explain yourself that much. And
Yeah.
it's like, why when you're just leaning into what you want? But
Yeah. But she was like, you don't have PCOS because you're not overweight. And I don't know what my face looks like. I can only imagine because I was just blown away that one, she would say that just out loud to a human. And I understand I'm not overweight. And would you say that to someone who was overweight? Would you body shame them as a physician if someone presented as quote unquote overweight? What even is overweight? All of that kind of stuff. And where are you getting this information? You do not have to be quote unquote overweight. You could be any weight whatsoever and still have PCOS. And I was just shocked. And I mean, I didn't go back for 3 years. And
well, that's what happens.
yeah, yeah. And I'm like, I'm so hesitant. And then before I left Virginia, I went back again and I had had a couple weird cycles and asked her to run some hormone blood work, knowing that it wasn't the best and just curious. Just
Mhm.
out of curiosity, I know to take it with a grain of salt. I know how to read, my own labs when it comes to this. I was just curious if she would be open to running some labs. And what she said to me was, because you get your period every month, give her from 21 days up to 40 days, you're normal and your hormones are fine. Once again, I don't know what my face did, but I was just blown away that one, you don't ask more questions of do I have symptoms? Do I have cramps? Do I have bloating? Do I get headaches? Do I have PMS? All that kind of stuff. But just because I happen to get my period, and also what does my period look like? Is it 1 day? Is it 10 days? There are no questions about that of just, no, it's fine. We don't need to test. And it brought a lot of stuff back up of just, I mean, thank goodness I know what I know. And I just, so much empathy going out to people who believe this, and of all sorts, across all different things, including hormones. And just, yeah, just a lot of frustration and sadness. Sadness really came up for me of people who just blindly believe anything that they're told because someone went to medical school. Yeah, just
Mhm.
a lot.
Yep, that is a great statement. And did she run the test or no?
No.
The same thing happened to me when I went, and she said the exact same thing when I said I would like to get some testing. I hadn't been in 5 years because of my past experiences, and I just, I do believe in screenings and whatnot for certain things, like, so that's why I went in. But yeah, she was like, well, your cycles seem to be regular, so you don't really need to do any testing. Again, you don't have any family history. I kid you not, it was like 3 questions. And I'm like, how do you know any information about what is going on inside me? Or how are you putting this together in your head? Like, I will never understand how it makes sense to them. And it's tough to not leave on a frustrated note after that. And so many people experience that. And we're going to these people trusting them, like going in, trying to be vulnerable, sharing all the things that are going on with us, and to just get like that shut down response essentially in your face does not make you feel good after you leave. And it definitely doesn't want to make you go back.
No, absolutely not. And I had a situation that I literally just forgot about until we started having this conversation. And you might remember this because we were working together when this happened, but I think this was at some point last year. I started having breathing issues where it was very challenging for me to take full breaths. And it was really like an all of a sudden kind of thing. It was impacting my sleep. I'd like wake up short of breath and then I couldn't catch my breath and I couldn't sleep. And I have no history of any sort of breathing issues. And I ended up going to urgent care. They took an x-ray and they were like, oh, you have asthma. Here's an inhaler. No other questions were asked other than the shortness of breath and how long it had been going on. And I don't have asthma. I've never had asthma. I had walking pneumonia in high school, or I'm sorry, in college. And that's the only like breathing issues I've ever had. And I'm a pretty healthy person. And, like for this to just suddenly come on and I had no other symptoms, it's not like I got sick and then I had started having breathing issues. I mean, they ran a COVID test. They ran, I think they some other test, a flu or strep, I can't remember. And they were like, nope, you just have asthma and here's an inhaler. And the inhaler, I did try it, trying to have faith that this would help, made it worse. And so I went back and said, hey, got this inhaler. It made it worse. I don't know what to do because I'm still having these breathing issues. And meanwhile, I had started to supplement with some things that I knew were supportive and were helping, but it wasn't quite fixing it. And it had been going on long enough that I was like, all right, something else needs to happen here. And they try to like, oh, go see a cardiologist. And I was like, I have never had heart issues. My heart rate, my blood oxygen, like all of this is totally fine. And just no other questions were asked. Lo and behold, it was an emotional thing and a trauma thing that was coming up for me. And once I did work around that, the issues went away almost immediately. I mean, within like several hours, I felt so much better. But it reminded me that it was really scary. I mean, it was really scary to not be able to breathe, for it to hurt and not be able to take a full deep breath while everything else seemed pretty normal. I had no other major changes going on and just no other questions, no other like even when I called a cardiologist, they were like, we can get you in 3 weeks.
I
Cool.
can't breathe right now. Like, I need help.
Yeah, like what about right now? Because what if this is a heart issue and you don't catch it? Like, there was a lot of fear and anxiety coming up around this. And I was just once again just really blown away, even by an acute situation, which is what Western medicine is designed for, is these acute type of situations that there was so little help. And it was and once again, it just brought up a lot for me. And clearly I blocked it out because I didn't remember until just now. And yeah, just once again, thank goodness I could advocate for myself and find other avenues to support my body, knowing that lungs and were all about grief and sadness, and maybe to dig into that. And I reached out to another practitioner who I knew could guide me through some of that, because even doing it myself, it wasn't quite cutting it. And that's what moved things along.
It's so important to listen to that, like that gut intuitive feeling that we have. Because I mean, obviously when something like that is happening, you are scared, you're going to get more anxiety around it because it's your breathing. That's like a main function that we need. And going in and not getting the help, but also knowing like, okay, I tried this, and then really tuning in and being like, all right, is something different here? Something's missing, and following that. And I think that's something that not obviously not all of society is very in touch with, but I do see people leaning more and more, like pushing in that direction. And that's only going to be more helpful for things like medical visits, because, if someone's telling you something that doesn't resonate with you, tune into that gut feeling and go try whatever your body may be telling you to try, and probably lead you in the right direction. Um, do you want to talk about maybe some tips in different things that people can do before going into the doctors, or if you're someone who thinks that you have medical trauma, and something around that?
Yeah, I actually just want to share one other thing
Yeah.
first.
Yeah, go ahead.
So, and if you've been diagnosed with an autoimmune condition, you will know exactly what I'm talking about. But there is a statistic out there, and I probably should have looked at this before we started recording, but there is a statistic out there where I think, and please don't quote me because there is a good chance, but I know it's in this range, that if to get diagnosed with an autoimmune condition, which women, by the way, we are more prone to autoimmune issues and diseases, you have to see somewhere between 8 and 12 physicians to get diagnosed with an autoimmune condition, which is mind blowing, because that means you were dismissed by at least a handful of them and then referred out by a handful of other ones in order to get your diagnosis. And as someone with a history of autoimmunity, I had Hashimoto's, I was diagnosed with Hashimoto's. I got diagnosed in the functional world. I've also been able to put it in remission. I was told I was going to have to go on thyroid meds, and I wasn't bad enough that I felt like it was super necessary and I wanted to try a couple other things. That is not the case for everyone. Some people do need thyroid meds. Some people do need to stay on them forever. Some people need a variety of thyroid meds. And, but that statistic really, I think, is a good, unfortunate, and good representation of how a lot of people, especially women, can be so dismissed in the Western medicine world when there is something very real, something that is diagnosable. Now it is challenging because there are so many autoimmune conditions. However, there's some major tests that we're able to run, and physicians can run even more than we can, and that we're trained in, especially physicians who specialize in autoimmunity, and there are quite a few. But it's just mind blowing how many people you have to see to get that diagnosis to be validated, and how much you have to fight in order to get that diagnosis, let alone any help and support with that diagnosis, because Western medicine does not have great solutions for autoimmune conditions.
Yeah. And to add to that too, autoimmune conditions, they don't just happen. Like, you don't just wake up and have an autoimmune disease. It is something that has been building in your body. There was probably things that started to happen years before it actually set in. So, I mean, there's that piece to it too. Like if you were someone who was going in or had been going into the doctors for tons of different issues that you were having and just continuously getting dismissed, and then eventually you go in one day, someone listens, someone does the test, and they tell you you have an autoimmune condition, like you have been continuously dismissed at that point, which I didn't have an autoimmune condition, but I can only imagine how that would feel.
Yeah. And I mean, mold is the same way.
Yeah.
Mold, I mean, people are going to get dismissed again and again and again and again and again, just with all of that. And it's just so unfortunate. And also, the other piece of autoimmunity, and I think there is some confusion around this sometimes. Yes, there's a genetic component. It's also not the only part of it. There are many other things that contribute to autoimmunity. The genetic component is a piece. There are other pieces, and then there's often a trigger for it. And that trigger can be an event like a car accident for me, which I think was the trigger for me. And there was many other things underlying even well before that, especially the trauma. By the way, if you have a history of trauma, especially childhood trauma, the likelihood of you developing an autoimmune condition in your life goes up significantly, like crazy significantly. I was basically destined to get an autoimmune condition with my level of childhood trauma based on everything, all the research and everything that I read. And yeah, of course, I was fortunate that I caught it at a point where I could reverse it and had the knowledge and could do that. So just wanted to clarify that. And yes, it didn't just happen. It didn't just pop up. There were underlying things. And there was also probably something that triggered it, getting sick, an accident, an incident, an emotional event, anything like that.
Yeah, I mean that's also a really big thing that we see. I mean, I have with a ton of my clients, like I can almost whenever I ask, I'm like, was there, and I know you asked this question too, was there a time, did you notice like when everything got worse or when did all this start to show up? And they actually think on it and they're like, oh my God, yeah, I can think of this specific event that happened. Like I got divorced and it started like 2 days after, or like the week after I moved out or something. It is insane how many people, when they actually take the time to think about it, can trace back and find a specific event where things just kind of like hit the fan.
And this is why asking, even in our free consultations, we ask a lot of questions, probably more questions than most physicians will ask throughout multiple visits. And this gives us insight into what tests do we want to run? What do we actually want to look at? What is likely going on? What are bigger root causes? All of that kind of stuff, because we know all of this matters.
Mm-hmm. Yeah. Yeah. So that being said, if you are a person who has been continuously dismissed, or you know that maybe, this is resonating with you, you're thinking maybe I have some medical trauma, one really good thing that you can do is, if you're still going into different doctor's appointments or just feel like nervous around it, anxious, you want to do something beforehand to help regulate your nervous system. And there's tons of different YouTube videos out there, free content on this. It might, and it's going to look different for everyone too. Like if you're someone who enjoys journaling, that's a great way. You can write about like what you're nervous about, what you think is going to happen, and all the things. Breath work is a really great tool for this, and it's a pretty easy tool for most people. If you haven't tried it before, start slow. Start with something that's like maybe 3 to 5 minutes. That's a good place to go. Somatic movements and all of this stuff. Maybe we'll throw some links in just to our favorite things, but I would say those are like three top things that I would consider.
Yeah, even just shaking, just, and I say this, from me and also from, just talking to so many clients of just that nervousness can get in your body and you just like feel it and you feel the anxiousness and nervousness and you're like, oh my God, are they just going to dismiss me? Is it even worthwhile for me to go in? And just turning on some music and shaking your body, just moving, shaking your body, shaking your arms, shaking your legs, just shaking a little bit moves a lot of energy and is so simple, so easy to do. And like 1 to 5 minutes will do a lot of good in just moving some of that. You can also do that afterwards too, especially if you didn't get the responses that you were hoping for, which is very likely. Doing that shaking once again, doing work kind of beforehand and afterwards can be really valuable to make sure that you're going in the most regulated that you can, and you're also re-regulating yourself coming out of it. I also think just understanding a little bit more, and this was really helpful for me, just understanding the Western medicine system of, hey, look, I'm going to get 5 to 10 minutes. They're probably not going to ask me a ton of questions. Maybe you go in with notes and you can share those notes. Just managing your expectations and being as prepared as you can be. And one of the things I did when I was seeing all of my doctors and everything was I almost had like a little template that I would take to everyone of these are chronologically when these things started. Here are the symptoms I'm currently experiencing. Here are like my top priorities, and just hand that to them and be like, I need you to read this because this is going to be more valuable to me for you to read this than for me to try and explain everything to you. And you're just going to cut me off and dismiss me. So please read this right now while I'm watching you.
Yes. And so I did that same thing. And I also added on all the things that I have tried, all the testing that I had done. It's just like, if you can keep everything in one place, it makes it so simple. And then they can visually see all on one piece of paper and hopefully not ask you the same questions or not suggest the same things over and over again. So I love that you brought that up. That's a really great tool when you're in a position where you're trying to figure out what's going on with your body and still bouncing between a lot of medical providers.
Exactly. Yeah. And just this also because they don't talk to each other usually either. This keeps everyone up to date as you're meeting with these different types of physicians and different types of practitioners of, hey, here's what I'm doing with this person. Here's the additional tests that they ran. Like, here's the results, all that kind of stuff. And once again, some places you can set it beforehand, question mark, if they're going to read it. I prefer them to read it in front of me. That was my personal preference.
Yeah, that's a good point. Just because, like you said, you don't know if they're actually reading it. And not, again, not every place is like this. And I'm not trying to, for lack of a better term, shit on Western medicine. That's really not what I'm trying to do. But it kind of feels like a business when you're in a doctor's office. It's very like, this person's in, this person's coming in, this person's coming out, like 10 minutes, boom, boom, boom. And they're not going to have time to read things like that. So actually handing it to them in front of them and making sure they're reading it is a really good choice.
Yeah. Yeah. So really valuable tool. And yes, it's a lot of work on you. Yes, to keep all of that up to date. I get it. I know how much work it is. And in my opinion, especially if you have a lot of chronic issues and you're seeing a lot of different providers, well worth the time and effort to put all of that together, because it saves you at least some of the frustration of re-explaining yourself again and again and again and be like, nope, already tried that. Nope, already tried that. Already have it tested. Already did that. Already been referred out. Like all of these things again and again, which just adds oftentimes to more anxiety and more frustration when you're already in those places to begin with.
Yeah, definitely. That's a really, really great tip. Yeah, I know it can be a pain too, but like you said, it's actually going to be beneficial for you as an individual in the end, just to stay organized with that stuff, and it helps take off some of the stress.
Yeah, exactly. Obviously because of the space we're in, we're going to probably recommend seeking out someone else in the functional space. And once again, I know most providers in the functional space don't accept insurance, and it can be a challenge, and it still doesn't hurt to search out, like we offer free consults. We will take a look at your blood work. and just take a look and let you know what we see. And if it's a good fit, if it's not, we will let you know either way. And what we think is going on, if we think additional testing is recommended, all of that kind of stuff. And by the way, we don't always recommend additional testing. I'd say more often we don't, because we know what's going on based on some basic lab work and just talking to someone. But seeking out another opinion. And once again, I know you're like, okay, I got to explain my story again. We've also had plenty of people send over those little packets beforehand, before a consult. And yes, we will read it and we will look at your labs before we go into the call with you. So yeah, just seeking out another opinion, especially an opinion in the holistic health space, functional space. I'll share this, and I know there are exceptions to the rule. And I also think this is valuable. Sometimes, many times in my experience, naturopathic doctors are not much better. And that is because they are also trained in Western medicine first and foremost. And so one question that you may want to ask or really think about, do you want this, is, has this person been trained in Western medicine? And one of the downsides is especially if they were trained in Western medicine first, which is most providers, and then they get into the holistic health space, they oftentimes come in still with the lens of Western medicine, of chasing symptoms, of managing symptoms. A lot of people that have chronic gut issues, chronic gut infections, SIBO, and they see providers like naturopathic doctors, they get symptom management. SIBO is a symptom, it's not a root cause. They're still they're looking at more symptoms, they're looking at more testing, and they still symptom manage and don't look at the bigger picture. So if you are looking to get another opinion to potentially work with someone in the holistic health space, just really think about that. Ask some more questions. And I just think it's really valuable because it's something I was not aware of when I got into the space, that oh, you're in the functional medicine space. You have to be better. You're going to fix me. You're going to look at bigger root causes. And by and large, that is not the case.
Mm-hmm. Yeah, it's unfortunate, but I can say the same. I mean, I had seen so many different functional practitioners who, knowing what I know now, what they were doing was symptom chasing. And, again, not anyone's fault. It's just a matter of maybe doing a little bit more education in that area and learning different things. And that's why we're here, because we've been through it and we're trying to share that information with everyone, that there is an end to this, there is a route. You got to find the right person and ask questions.
Exactly And I also just want to throw this out there too, and this came up for me literally earlier today with a test result that I got back from a client of, if you're experiencing a lot of chronic issues and you're like, I'm going to take matters into my own hands, I'm going to do this myself, please be really careful about supplements that you're taking, about things that you're doing. If you are not well versed in certain things, especially, I mean, this really goes across the board. This instance was in case of hormones. Just know that you can do more harm than good in your body. And that's not to scare you. That's not to say don't take matters into your own hands, because yes, you absolutely need to do that. But please really, really, really do your research before you start doing this yourself. Because, for Shannon and I, we've been doing this for years. I've been in this space for over 9 years. I have hundreds and hundreds of hours worth of client experience, of actual case studies. And I still, the three of us, the three practitioners in this practice, we talk to each other all the time, ask questions about each other. And hey, what do you think about this? Hey, we have a very collaborative practice because we all have different viewpoints and opinions. And sometimes there's something that we don't think of. And that comes from a lot of experience and education, of course, but also a lot of experience. And I I see this more often than I would like, of people doing more harm than good to their bodies with some of the supplementation, and even like therapeutic diets, elimination diets, and doing these things that can for some people oftentimes lead to more harm than good, especially in the long run.
Yeah. And that's, I mean, with supplements and especially the therapeutic diets, like, I mean, I get it. I know that they can be helpful, but there's a time and a place, and diet is almost never going to fit unless you're eating like a horribly processed standard American diet. Like, from our experience, from our years of experience, diet alone is probably not going to fix the issue that you're dealing with. So yeah, you really do have to, again, listen to yourself, do some research on your own, ask questions, get clarity, make sure you understand, and then proceed.
Exactly. And, reaching out to groups can be very beneficial and getting support and just, having a community of people who have been through similar things too. And also recognize every person and everybody is different.
Mhm.
So once again, just like really listen to yourself, really tune into yourself. Just because this worked for one person doesn't mean it's going to work for you. And who knows what else was going on
Yep.
in their lives and all that kind of stuff. So just, I know when we have medical trauma, we can really just try and do this all of ourselves. And because we're scared, we have this anxiety to go to medical practitioners or see any types of practitioners, but also a little bit of caution at if you do this, that sometimes, especially when people have come to us, and I don't want to share with anyone, hey, by the way, you've been taking this supplement and this actually made all of your issues way worse. And I don't want to do that. That's not fun for me. I want
Yeah.
people to get better and feel good. And I don't want to share that kind of news with someone. So just be very mindful and careful, and try not to rush into anything. Also know if you have a lot of chronic issues, there's probably not a quick fix. A particular supplement is probably not going to fix all of your issues. So just really keep that in mind, that yes, taking matters into your own hands can be really valuable and can be a little dangerous sometimes.
Yeah. And just one last thing to piggyback off that is another big difference between like the functional world and Western medicine is, especially if you're coming to us, like we will be upfront with you. It is not the same as taking a pill and your symptoms getting better. This is like deep rooted healing, undoing years of things. So it's naturally going to take longer than that. We always tell people, think about how long it took you to get to where you are now and how you're feeling. And what we're doing is going back and undoing all of that. So it is naturally just going to be a longer process.
Yeah. So hopefully that helps. We know, we understand, we have been there. We continue to still be there because once again, we do see value in Western medicine, and we both see Western medicine practitioners, doctors, physicians, whatever you want to call them, for ourselves as needed, even just for regular screening stuff. And we still experience this. So you're not alone. Reach out if you need support, if you need to vent. We have been there. We totally understand. And if you're looking for a little bit of a different approach or just another opinion, we are available. And once again, there is no pressure to work with us or buy anything. We want to help you, and we want to support you in any way that we can. So please don't hesitate to reach out. Please don't hesitate to book a free consult with us.
Yes. Yeah. We love that. Send blood work. If you have it, that's even better for us. We love seeing it beforehand.
Yeah. And if you're thinking about ordering any functional labs, please talk to someone before ordering them. Just please book a free consult with us beforehand, because we may recommend something different for you. And we are well versed in these labs. We know the differences. We know, based on what you're experiencing and your history, what may be a better option or the best option for you, or multiple options. And just encouragement to chat with us before that.
Yes, definitely. We don't want you wasting money. So just ask first.
Yeah, we have wasted so much money,
Yeah.
in our own healing. We don't want you to do the same. We've wasted money and time and all that kind of stuff. So if we can limit some of that for you, we would highly enjoy that.
Yeah, we will do our best for sure.
Yeah, yeah. Well, awesome. So medical trauma. Hope you enjoyed it. Hope you enjoyed Sherry's and stories and got a few tips and tricks out of this. And maybe you just don't, maybe you feel less alone, which is a huge win in my book. If you just feel less alone in your struggles here. So thank you so much for joining us. As always, any subscribes, 5-star reviews mean the world to us. They really, really do. They help us out so much. So if that resonates, we really appreciate it. And thanks for joining us. We will see you next time.
Yeah, thanks everyone. See ya.